Hello my friends, welcome back to my channel. In today's video, we will talk about the landmarks of vertebral body and also the differences between different parts of vertebral body or spine column. Today is the third video of the anatomy series, and if you're new here, I'm Karis, I'm a physiotherapist. In this series, we will learn more about anatomy. So we have 33 to 34 vertebrae of the spine. Respectively, we have 7 cervical vertebrae, followed by 12 thoracic vertebrae. Then we have 5 lumbar vertebrae, followed by 4 to 5 fused sacrum vertebrae, and followed by 3 to 4 fused coccyx vertebrae, which make the spine. We have some differences in these vertebrae of each part, so depends on their function and their placement. The vertebrae are a little bit different. So a typical vertebrae will look like something like that. We have a vertebral body, which is anterior part. Then on the posterior, we have arches, which arches consist of the process that goes backward or posteriorly, which is spinous process. And the processes that goes laterally, call it transverse process. The body and the arches are connected to each other by pedicle, and the spinous process, which is the process that goes posteriorly, and transverse process, the process that goes laterally, are connected by a lamina. And we also have superior spinous process, which articulate with the upper vertebra, and inferior spinous process, which articulate with the lower vertebra. Between the arches and vertebral body, we have a hole, which is called vertebral foramen, which spinal cords go through it. And when the vertebrae are stuck on top of each other on the right and left side, they make intervertebral foramen, which the spinal nerves come out through them. So this is the typical vertebra. Let's look at each part of vertebra. On the uppermost part, we have cervical vertebrae, which is 7 cervical vertebrae. The first cervical vertebrae, call it Atlas, which the name comes from the man who is named Atlas. I don't know, it's mythology or something. Actually, I don't know anything about it. It's maybe a fantasy or something like Roman or something, I don't know. But it's important, not important actually, but if you know it, it's make it more easier to remember. So this man's hold the word on his shoulder, so the name comes from that. So Atlas is holding the skull, so the name goes back to this man's name, Atlas. And in Atlas, we don't have any vertebral body, so it's look like a plate, and it has a very wide superior facet to articulate with occipital bone, as we talked about in the previous video. And when they articulate, they give us the ability to saying yes and nodding like that. It gives us this ability. And then in the cervical vertebrae, we have something that we don't have it in other vertebrae, which is transverse foramina or foramina transversum, which is come from the name transverse because the whole it's in transverse process on both sides. This is important for cervical spine because the vertebral artery goes inside it and then it goes to the brain like that, which we do often. And that's it. And I think this is it. And we also don't have spinous process, so we don't have vertebral body and spinous process in the first cervical vertebra, which is Atlas. The second cervical vertebra is Axis, which also have a different thing, which is a process that look like a teeth comes out from it, which is why we call it odontoid process or dens, which is the name come from the teeth because it look like a tooth. And odontoid process will articulate with the atlas in the inside of superior arc, and here we have odontoid process. They articulate here, and then we have a ligament here, to prevent it goes backward, because in the back of it we have spinal cord to prevent it from damaging it. And the articulation of atlas and axis, call it atlantoaxial joint, which make us ability to doing rotation like this, to say no, which is important thing you should learn. And yes, that's it. And then third cervical vertebra to seventh cervical vertebra are typical vertebrae, which is look like this. The vertebrae in the cervical, as we say, they have transverse foramina, which is different than other vertebrae. And they also have a bifid spinous process, which is bi means two. We have mono, bi, tri, tetra. Bi means two. Bifid is, we mean the two-headed spinous process, which just look like this, while the other spinous process in the other vertebrae are one-headed. They don't have a two-head, but in cervical we have two-headed spinous process, which we call it bifid. So I think that's it for cervical vertebrae. And of course, there is discus between vertebrae that we will talk about later in the video. So we have cervical, and then we have 12 thoracic vertebrae that attach to 12 ribs by 3 points. And the points are superior demifacet, which is on the top part of the vertebral body of thoracic, which is attached to the head of the rib of the same level. For example, if we have fourth thoracic vertebrae, the superior demifacet or superior costal facet, also call it, attached to the head of the rib of fourth rib. And inferior demifacet, which is on the inferior part of vertebral body, are attached to the head of the rib below this level. For example, in this case, it is attached to the head of the fifth rib. And then we also have other points that connect to the tubercle of the rib of the same level, which is called transverse costal facet, which is on the transverse process. We have these 3 points that connect ribs to the thoracic vertebrae. And then in thoracic vertebrae, vertebral body are larger compared to the vertebral body of the cervical vertebrae, and the spinous process larger and also pointed more downward. Then we have lumbar vertebrae, which there's not that much to talk about. They are typical vertebrae, but their vertebral body are the largest compared to the two above, and they also have a larger spinous process but smaller one. And we also have transverse process, vertebral foramen, intervertebral foramen, all the thing. We have it here too. And then when we come downward, we have upside down triangular shaped bone, which is called sacrum. There are 5 fused bones that attach it together. In sacrum, we have a sacral canal inside, which the cauda equina goes through it, and we have a foramina, sacral foramen, anterior and posterior, which the spinal nerve, sacrum nerve, S1 to S5, come out through it. In the sides, we have auricular surface, which is look like an ear. That's why we call it auricular, and it attaches to the pelvic, which they make a sacroiliac joint. And then on the anterior part, we have holes. The holes, as we said, call it sacrum foramina, anterior sacrum foramen. And we also have a margin, which are the lines of the sacrum vertebrae. On the posterior side, we have crestes, which we have lateral, intermediate, and medial crest. Between the lateral and intermediate crest, we have posterior sacral foramen. And then we come downward, we have coccyx, which are 3 to 5 fused bone that they also fuse it together. The uppermost one is the largest one, and then when we come downward, they become smaller and smaller because they don't bear that much weight. Their size is small, but they have very important function while they being an insertion and attachment of different muscles, ligament, and tendon. They also work with the ischium while we sit down to hold the body weight. This means while we're sitting down, the ischium tuberosity and the coccyx work together and they bear our body weight, which the name of coccyx comes from the group of certain bird. If we look at the coccyx from lateral view, we will see it's look like this. It's same as the brook of this bird. That's why they name it after it. And then last thing is disc. The disc contain of two parts. We have nucleus pulposus, which is a gelatinous part, and outward we have annulus fibrosus. It looks like a tire of or filled donut, we can say, something like that. The outer layer is more rigid. They hold the nucleus pulposus inside. The discs act like a shock absorber, which we can find them between the vertebrae of the spine, which that's why they call it intervertebral disc. And they also give us the ability to do flexion and extension of the spine, and also a little bit of spine rotation. That's it for today. I hope you find this video helpful, and if you did, don't forget to like, share, and subscribe our channel. And stay safe. See you in the next video.